I think this is a critical part of the future of medicine. I think medicine is coming to the point where we've got to use the tools in front of us to help us identify these patients. At Eisenhower, I joined there as a cardiac surgeon back in 21. We had a nice TAVR program at that time, a nice structural heart program, but there was a lot of opportunity there. We just needed some tools to help us be able to, one, identify the patients before they got sick, before they ended up at the hospital in an emergency situation. Two, we needed to identify patients that we had in our system so we could plan for future growth. And then three, as we were doing that, it really allowed us to look at the efficiencies within our program about how do we quickly get these patients from diagnosis to treatment. If you think about the amount of patients that are coming into the cardiovascular programs across the country, that number is increasing. Our therapies have increased. Our ability to treat patients both surgically as well as through transcatheter technologies is only going to increase. And what we're finding in the data, if you're staying on top of even just the aortic valve, aortic stenosis data, what we're seeing is that earlier treatment is actually, one, saving lives, and two, better for long-term outcomes of the overall heart functions.